Hello, everyone. Thank you for joining us today for our Fresh Dental Shadowing session. Today we have Dr. Hasan, and he's going to be giving his presentation on dentistry and his specific field. So thank you so much for joining us today, and you can go ahead and get started on your presentation.
All right, thank you so much for the invitation. Sorry, I got a little rusty voice. Kids are petri dishes, so whatever they bring from school, they bring it to you, and eventually going to catch it up. But I'll get rolling. So my name is Dr. Fadi Hasan. I'm a practicing periodontist. I practice in DC, Maryland, and Virginia, 3 states actually. I'm board certified as well, so which means I went to dental school, then went to specialty, and then got my board certification after that. So I kind of jump into as far as where I'm from. I'm originally from Baghdad, Iraq. I grew up there, did my dental school there originally. So I finished with a bachelor's of dental surgery in 2007. And then in 2008, I immigrated to the United States, and I did my dental school again. So it's called a 2-year international dental program, or the advanced standing program. And that's a program that's specifically kind of designated for foreign trained dentists who want to practice in the US, and the way to earn a dental degree again. So I got my second dental degree in 2011 from the University of Colorado in Denver. That was a great experience, a phenomenal school. And hopefully if you guys are applying, worth checking it out. Their quality of education is like nothing else, honestly, I've seen. And it's a beautiful city to live in. So hopefully whoever lives in Denver, if you guys have a chance to, go to the dental school and check it out, please do so. In 2011, I graduated. I practiced as a general dentist actually for about over 6 months. And then, I was always interested in periodontics, which is, it's pretty much our specialty that we work around gums and teeth. And our goal is to make sure the foundation is healthy. So if you're getting braces, or if you're getting a dental implant, for example, anything like that, or gum grafting, that's where you guys get to come to us. We clear you guys, make sure everything's stable and healthy before you guys get to move on to the next step. Again, like I said, I started dental residency in 2012. Periodontics is a 3-year residency program. So the nice thing about it is that we do a lot of gum surgeries and a lot of surgeries in general speaking, but we don't have the lifestyle of an oral surgery resident, which is on call, being in hospitals, night shifts, trauma cases. We don't do any of that. So I get the fun part of the surgery minus all the crazy lifestyle that the oral surgeons get to do. So that's the beauty about our specialty, is it? In 2016, I got my board certification after I graduated 2015. And I've been practicing in the DC, Maryland, Virginia for over 7 years now. So it's been a fun journey. There's a lot of, you get to, grow through the process. Also a part-time faculty at VCU, which is Virginia Commonwealth University. So I go there once a month. I drive from DC all the way down to Richmond. And I get to be with the residents and also with the dental students. So since COVID happened, I've been strictly with the residents after that, and I get to show them kind of what cool surgeries that we get to do in private practice, and how we communicate with the patients. So it's been fun over that as well. One of the other things I do is that I am a co-founder of what's called the Periodontist, which is it's a course that's dedicated for dentists as well as specialists to advance their soft tissue clinical skills, and where we focus on teeth and dental implants, and kind of break it down and how we can manage those really clinical scenarios when we do present in our private practice. So, like I said, again, I'm a graduate from University of Baghdad 2007, and then went to Colorado 2011, and then BCU dentistry for my residency in Richmond, Virginia. And again, it's been an incredible experience, and I go back there, like I said, once a month. My Instagram handle is fkh.implant.perio. So if you guys want to see, I post all my surgical cases. If you're into surgery and it doesn't disgust you, by all means, go ahead and check it out. Otherwise, it's really cool. I show all my cases through it, and so I even get a lot of patients through Instagram. So it's been a really great practice builder for me as well through that process. So for where do I practice? I practice, like I said, in Maryland, Virginia, and DC. I literally practice 3 blocks from the White House. So anytime there are issues or riots, they close the streets and we have to shut down the clinic. Not the most amazing scenario, but it does tend to happen. So, but DC is a beautiful city. If you guys ever visit DC, or if you are in DC or in Virginia, you wish to shadow, please reach out to me. We get a lot of pre-dental, even dental students who are interested in our field that want to kind of learn more about what we do. So it's all, the invitation is always open. Just reach out to me through my Instagram handle, and we'll definitely set a time and a date that works best for you. And we'd love to have you guys over anytime. So I'll give you a little bit something what we do. So we do a lot of cool procedures. A lot of patients sometimes have, broken down, decayed teeth that need a lot of work and rehabilitation. I'm the guy that works on the surgical part. So my goal is to, like I said, is to make the foundation healthy and stable before the beautiful final crowns can go in. So like a case on the left side you see here, you have a patient who is in there 25 years old, history, there's a history of drug addiction at that point in time, but now they're clean, they're ready to move on with their life. And there's a lot of decay with those patients that come to us. So there's a lot of approaches we can go with those. We can either be aggressive, take out all the teeth and just do implants or dentures or anything like that, or you can go more the conservative route and just do what's a procedure called a crown lengthening procedure, where we're removing some gum, we're removing some bone, and we are literally putting things in the right position, in a biological healthy position, before they get their nice final prosthesis. So as you can see, the case on the left, that's only a provisional, which means it's only a temporary prosthetics that he's wearing. It's only 2 weeks out, but an amazing transformation for a 25-year-old who's ready to change their lives. A case on the right side, it's a very similar approach, but this is a patient, she has beautiful teeth. She just has very thick gums, and we call them the gummy smile patients. So sometimes patients smile and you see there's a lot of gum showing. They don't notice it until maybe their dentist might point out to them, or sometimes later in life they're consciously aware of it. So the one on the right side, you'll see what's called, we start with a gingivectomy procedure, which means we're slowly cutting the gums away. So we'll start one side, one half at a time. Once we do that, then we're gonna reflect the gum, we're gonna approach the bone, and then we're gonna modify the bone in a biological rational position. So we measure everything in millimeters, and whether we're removing 1, 2, or 3 millimeters of bone or gum, and then we have to suture everything back in the right position where we want things to be, and then just let the tissues and the gums heal nicely. So it's amazing transformation when the patients walk in and immediately they walk out. They can see those results with this procedure. It's maybe one of my favorite ones, I would like to say, because like I said, the transformation is almost immediate. Like patients are like, oh my God, I have a new smile, and I can smile better. I don't see a lot of gums. So it's definitely, touches your heart in a lot of ways, and patients are really appreciative of those very fine changes that you can do for them. So it's one of the things that we do a lot in our practice. Hopefully you guys don't need it, but again, if you do need it, at least there are these procedures that specifically dedicated for this kind of work. One of the other procedures that we do is called gum grafting. Basically, it's a result of patients either having recession that's developed over time, so maybe from braces, aggressive brushing habits. Sometimes patients have genetically thin gums, and our goal is to change that quality from a thin gum to a thicker, better quality gum. So the one on the left, it's called an autogenous grout. This is a graft where we harvest it from the patient's roof of the mouth. Some of you might already have it, like they've had in this lower 2 front teeth. It's really common, and we see it a lot. We do a lot of our 8 to 10 to 12-year-old, even our 16-year-old patients who are doing braces, orthodontics. And sometimes our patients are in their early 20s that have had braces, and now there's some gum issues are developed. So we will harvest a piece of graft from the roof of the mouth. We will stabilize it in the lower front teeth, or depends where you need it. And then we'll let kind of the gums start with a few sutures and let things heal like that. The one on the right side is a slightly different approach. It's still a gum graft procedure, but this is a patient who has advanced gum recession. You can see the roots are showing in that upper right side, where you can see that yellowness of the roots. So our goal is to harvest the gum, stabilize it nicely, and then we will pull up the gum and cover those roots and the graft at the same time. And this is a 1-year follow-up. You can see at the lower right side how the tissue is nice, it's thick, everything's well covered. Patients don't complain about sensitivity. or discoloration, and also you're protecting it from any kind of decay that might develop on those root surfaces. So again, the beauty of it is there's always more than one technique. There's more than one surgical approach and different graft materials out there. So for an example, besides our own tissue, there's also donor skin, which is cadaver skin that comes from dead people. They harvest their skin, and basically they will sterilize it, and then we can use that product as a material to also augment the gum and make things thicker. Really advanced gum recession. So this is a donor skin. You can see those small dots. That's actually where the hair follicles were. So if you go to a tissue bank and you see the skin harvesting, which I've had a chance to see, that you can actually see they pluck out every hair follicle. So it's a really cool process that they do, and then they sterilize it in specific ways. And then that's your 2-month healing process at the lower left side. And you can see how beautiful, that thick that tissue is, and how much of a nice coverage of those roots that we were able to achieve. The picture on the right side, it's a very similar case, but this is on an upper teeth, not the lower teeth, but on the upper. So again, this is another guy who's in his mid-50s, but again, brushed the heck out of his gums until pretty much there. Sorry, you can see a lot of the roots are being exposed. So this is another technique where it's called a tunnel technique, where we insert the graft through the sulcus of the tooth, and then we slowly work our way towards it, and then we'll pull things up and let things mature and heal. So the suturing is the most finesse part of it, because I call the sutures is your signature move at the end of the day. So the smaller the suture, the more finesse you have it, the more beautiful your outcome can be. So this is your, again, 6-month follow-up of what's called a tunnel technique, and with a donor skin. And can we just look at the before and after on this case? So we can get a lot of bone, a lot of root coverage, because his patient has bone loss that's developed over the years. But for what he has, it's a definitely major improvement in compared to what we started with. Other things that are also very well known is our implants. Periodontists, we're the most, pretty much, if you have ever heard of us, we're really anal about placing our implants and how everything should be within tenths of a millimeter. So these are called the immediate implant cases, which means a tooth comes out, it's either broken or there's maybe some form of infection, and an implant goes in the same day. And the goal is for the patient to walk out with a fixed tooth on their implant in the same day if possible. So it's a really step-by-step process where we extract the tooth very carefully, implant goes in, there's a bone graft, and a lot of times we can use a patient's own tooth. We cut it off and we use that to fabricate a temporary crown that's literally fixated and screwed into the implant. So just kind of step by step to see, as far as a service that we can provide to our patients and maintain, aesthetics, which is really key for a front tooth, because no one wants to walk out from a dental practice and have a front tooth missing. I'm sure you guys don't want to, and I would not want that to happen to me, but these things can happen. And the patient on the right, poor guy, he's like in his 70s, broke one tooth, literally a week later broke the other one. So we did 2 immediate implants a week apart, and we were able to use the same original crowns that he had as temporary crowns, and they were fixated to the implant. So it's an amazing how the transformation and the results that we can achieve for our patients within a short period of time. So these are one of the services that we provide for our patients as a periodontist. So definitely a multitude of cases that we can go with. So these are one of the simple cases, I like to call them, like when it comes to implants. The more advanced ones are something like this, where patients have advanced gum disease and their teeth are really loose, and there's nothing much we can do to help save them, even though our primary objective and goal is to save those teeth. But these are the cases where we have to be a little more aggressive, where we have to take out the teeth and shave down all the bone, place implants in strategic positions, and once the gums and the implant heal, then the patient gets their final prosthetics, which is a fixed prosthesis that you can literally cover the entire mouth with 6 to 7 or maybe even 4 implants. So I'm sure you heard of the concept all-in-4, if some of you have been dental assistants or worked at dental offices. I'm sure doctors have restored some of those cases, or some of them maybe even do them themselves. But this is called an all-in-X. Could be 5, 4, 6 implants, 8 implants. We just like to call it all-in-X. That way, just as a general for an X number of implants. But that's the goal. Like, we want to achieve health and stability for our patients and functionality, because most of those patients, there's pus coming out of their teeth and especially their gums. Everything's loose, everything's moving around. So it's an amazing what kind of transformation we can achieve for those kind of patients, within a 6-month period of time. And the beauty about those ones that they can walk out with a fixed new set of teeth within the same day, if it's done properly right and it's planned properly as well. So that just gives you an idea, also another example what dental implants are and how we can use them and the benefit for the patient. So whether it's a single tooth, whether it's 2 teeth, a bridge, or it's a full mouth rehabilitation. But these are the techniques that we have that's been developed over the years, and we're just getting better at it now with new cool gadgets like dental technology and digital dentistry. So it's been really fun kind of seeing that evolution of dentistry over the last 5 to 7 years that's been happening, and just where we are today. And I'm excited for hopefully the next 20 to 30 years what's going to be coming to us. So, we showed you as far as, what we can do from the most basic, which is your aesthetic crown lengthening for gummy smiles, to gum grafting using the patient's own tissue, to a single implant, to a multiple implant. So it just gives you a good scope of what our specialty does as a perio. But we also are specializing in what's called bone grafting surgery. So patients who have had, some loss, a lot of their, parts of their jawbone, not too much of it, but to a certain degree, where can we reconstruct that bone in a specific way? Can we use, human bone? Can we use their own autogenous bone we can harvest from specific parts of the jaw? And can we stabilize it with screws and pins and, augment it and let things heal and come back for a beautiful rehabilitation over time? So this is a really great case. This is a patient he's in maybe like 42 years old, who's had advanced gum disease that's developed. And we had to take out some of the teeth at the front, but we couldn't do any bone grafting at the beginning to help rebuild the bone, because there's just too much disease that was involved. So sometimes we have to stage those cases, take our time, take out the tooth, let the gum heal, let's get rid of all that bacteria in the area. And once that happens, then we'll come back 2-3 months later and we'll start that reconstruction process. So a case like this where we had to take bone from his ramus, and then we took a piece of block, we cut it in half, and then we fixated with specific micro screws. And then 2 weeks later, you'll see how the healing is. So we were able to get a beautiful, what's called a vertical augmentation, which is one of the most challenging type of augmentations to get that vertical, because there's always a risk of exposure and complications that can develop during that healing phase. And you have to wait a long period of time, at least anywhere between 6 months to 7 months sometimes. So at 4 weeks, everything's looking great for this young patient. Let's look at it 7 months later. So 7 months later, and we have this beautiful bone that's been built. So this is a CAT scan or a CT scan. And you can see how much height we're able to regenerate those beautiful bones. So, and for re-entry, once we go in, we're going to remove those tiny screws, and we're going to place our implants based on the design that we have, and talk with our referring doctors who are going to restore this case to functionality within the next 2 to 3 months' time. So, from a width-wise, we were able to gain, 10 millimeters, almost 12 millimeters of width when he has started with only 2. So it's just incredible what we can do in our field, from minor soft tissue grafting to very advanced bone augmentation procedures to help reconstruct patients' jawline, and also improve the interior mandible and help reconstruct that whole area. Another case is what we also do is, we can build bone around missing sites, but what about patients who have already existing teeth, but they want to save their teeth? Their goal is to kind of save it and preserve it for a much long period of time, So this is what's called the guided tissue regeneration, or it's another type of bone reconstruction, but it's aimed around a natural tooth. It's not aimed for an implant placement, but where we want to save the patient's natural tooth. So those are the cases where we're working with literally sometimes 0.5 millimeter to 2 to 3 millimeters, which is very, very minimal. But we use a lot of microsurgical approach from our incision design to the way we reflect the gum, versus you saw in the previous case, that's what's called more of a macro surgery. It's using a much bigger, flap elevation, much bigger bone grafting harvesting. This is when we're working in literally about millimeters and tenths of millimeters on how we can really gently rebuild the bone and how we can put back the gums perfectly where they should be. So this is a beautiful case that we have where there is a defect that extends from the front to the back or in the patient's front tooth. And now we have to reflect the gum, clean out all the gum disease out there, make sure the bone is super clean, super healthy, and then we will slowly pack bone in and then just close it up and let just things heal. So beautiful 3 weeks post-op. You have 3 months as well. The 3 years, and you can see how with x-rays, you can see that the bone is slowly regenerating. There's a major defect on the first one, the x-ray, like the bone looks more slanted. This one looks like the bone is slowly filling in, so it's looking more horizontal. So then we have the 4 years follow-up, and again, nice bone regeneration that we're able to achieve. And the patient gets to save their front teeth, and not one of them, but actually both of them. So these are the cases that are really exciting for us that we get to, as periodontists, our goal is always to save natural dentition whenever possible, and that we can preserve them long term. So this kind of gives you a good example and idea, as far as from what we do as periodontists. And I'll leave it up to questions. That's pretty much what we do. And hopefully you guys, if you guys get to the field of perio, please, in the future, reach out to us. We're here to help you guys and guide you guys throughout the process. And hopefully you guys can be our colleagues one day and, work with us in the future if you ever come to the DC, Maryland, Virginia area. So with that, I'll leave it up to questions as far as what I do or how we got here. So feel free, please.
Yeah, thank you so much. We really enjoyed all those images. I feel like it makes it easier to understand what exactly you do. But in regards to questions, we can kind of start from the beginning of your journey. So how did you decide that you wanted to become a dentist?
Good question. I actually didn't know. I hated dentistry, to be told. I wanted to get into med school so badly, and my GPA, I think, back home was 0.1 from getting me into med school. So I got into dentistry, and I've loved it ever since. Just from I think the first day I carved my first tooth using those small wax blocks that they give you at the dental school. From that, I was like, yeah, that's it. I just have a true passion for it, and I just started carving teeth, and from your centrals to your canines to your molars, all the stuff that they teach you at dental school, and after that, I became actually one of the instructors at my dental school back home, and I started teaching them how to do. Every time there's a new first year coming in, they would always call on me because my carving was apparently really nice at that time, and they almost like, you want to be a part of one of the instructors for teaching them how to carve teeth? I was like, yeah, sure. And I kept doing that until I graduated, literally in 2007. So and I just developed a great passion for what I did. And again, I'm from Iraq, so clinical, the situations there at that time wasn't the most stable. You're talking about from 2002 to 2007. So, definitely not the most stable country. Whoever knows what would happen back there. But yeah, we were able to get through it. There's a lot of ups and downs and in that process, but, we were able to manage and graduate, thankfully, and then, find our way to the States and get our dental degree one more time. So, yeah, that just gives you an idea.
Awesome. And then specifically for you becoming a periodontist, what influenced that rather than being like a general dentist or another type of specialty?
Oh, good question. So, true story as well. I really hated perio. I was just terrible at it in dental school, even back home, even when it came to the States. And in Colorado, it's like, man, I can't get this specialty. I don't know what perio is. It's just hard. And I just couldn't understand how perio works. So I got into perio because one of our faculty at Colorado, he decided to do a non-accredited class after hours, and he opened an invitation to the dental students for us at that time when I was a dental student there. And it's like there's no credits, but if you guys want to learn more about perio, we're going to bring some residents in and some practicing periodontists in the Denver area, metropolitan area. And from there, I started attending. So I think we started about close to maybe 20 students. By the time I think the end of this, almost now fast forward 1 year later, when we attended every day during our summer, we didn't have summer breaks in Colorado. They only give you 1 week between the finals until summer semester starts. So every day during the summer semester, I would be in after hours non-credit class every day for almost 3 months. And then once this fall semester started, we did it about maybe once a week to twice a week, I think, and then became once every 2 weeks until I graduated from dental school. So and he's the guy also who got me into it, into perio. If it wasn't for him, I don't think I would ever apply to it. I was between that almost going for root canal specialty endodontics because I was really good at endo and I understood endo so much better. So when I was applying to perio, my faculty looked like, really? You're into perio? I was like, yeah, I really love it. I was like, why? It's like, because I like it. It's like, no, you should do something else. It's like, no, I really want to do perio. So they didn't believe me at the beginning. And I had to convince them really that I want letters of recommendation from you guys so I can apply to perio. And perio's been ever since. I just, as a specialty, I love it. It's fun to do. And there's so much cool stuff about it. Every time I take a new educational course for myself, you learn something new, and it's just a never-ending, evolving specialty. Honestly, it's a really fun time to be in a periodontics.
Okay, cool. And then speaking about dental school, how did you find that dental school environment? Like, was it competitive? Was it more like collaborative, or how do you describe it?
So for us, I'm gonna apply, at least talk about my experience in the U.S. For me as a foreign trained dentist, in order to get into dental school, we have to take the National Dental Board Examination, which is the NBD Part 1 and Part 2. We also have to take the TOEFL exam. At our time, the boards were actually graded, so you had to have a specific score. The higher the score, the more likelihood you'll get an interview and even get into it. So for me, I got lucky, honestly. Colorado was the first school that I applied to, and the first school I got an interview at. And I had a good, very good personal statement that I had written, and because of my history, where I came from Iraq, and the challenges that I've been through. And so they really they were interested, like, who's this person that's applying, that's been through all these ordeals back in Iraq, and now he's the one he wants to apply to dental school in Colorado. So when it came to the interview, I think Colorado is one of the most friendliest interviews I've ever seen. Anyone who goes there and walks out, they feel so relaxed and comfortable by the time they leave. And part of the interview process is that you have to do a bench exam, which is a clinical hands-on exam about how to do cavities and fillings and wax exams. So that's just part because you're a foreign trained dentist, so you should very much know these experience. So I get to do that, part of the interview process. And again, luckily, I got accepted. So it was the first school I applied. First school I got into. I did apply to other schools, but they rejected for an interview because my Part 1 score just wasn't high enough. It wasn't like above 90, which that would really guarantee you getting a spot for interview. For you guys who are undergrads, it's all about the DATs and your GPAs and all the extracurricular activities. For a foreign trained dentist, it's very different. So it's a different application cycle. It's even we started school in Colorado, we started school in January. We don't even start school like in, let's say, July or August or September like other schools do. So we started in January, but we graduate in December, which is kind of unique from all the other programs out there. Which it's a good opportunity for a fresh graduate because there's no there's no competition for us when we graduate and go into private practice, because you're the only school that graduates in December. Some people are already looking for jobs, like looking for dentists to hire. And well, here you have 40 students that just graduated, and everyone's willing to hire them. So that was the beauty about Colorado. It's kind of unique about it. It's just that you don't graduate the rest of the dental students with your friends that you've developed over those 2 years in May, or where you're supposed to graduate.
Okay, I see. So there is like a good difference between how you do it and like how it would traditionally happen here.
Yep. Yeah, for foreign trainers, absolutely difference.
Yeah. And then while you were at dental school, did you take part in any organizations on campus?
So for me, when I got into dental school, I was the class president, maybe the youngest class president, because again, as a foreign trained dentist, I started at the age of 25, which is very similar to a lot of dental applicants. But I started as like a third year. So, but my colleagues who are also foreign trained dentists, they're like 10 years and 15 years ahead of me. So I'm like the baby of that class compared to them, who they've had 5 to 10 years, even 15 years more experience. So I was in the class president. I was in the curriculum committee for the international dental program. I was also in the interview panel for any future applicants as well. I was in the vice council, the student council vice president as well. I wanted to be involved more and with a little more leadership skills. So that I just started kind of, working into my way to those things. As far as organizations, the only thing we do have there is, through doing Missions of Mercy. That's the only thing that, if you guys have heard of them, where they take you some remote locations and you guys get to treat as many patients as you want. It's more of like a free clinic. And you'll be there maybe 2-3 days. So that's more of a volunteering, situation that if you wish to go to. But yeah, these are the kind of organizations that we do have. Is more of if you're into that, student council or curriculum committee or interview panels or something like that, part of the interview committee as well. So that's the part that I really want to kind of invest myself in, because I was just really interested into it. So those are the ones that I got myself into. There are other organizations like that they have within the dental communities as well. I don't think I was really interested in other ones besides what I was really involved with the students themselves. Other ones, very much you can go in. There are a lot of fraternities out there, and dental ones, and you can just go in. It's more about beers and drinks and alcohol and enjoy your time. That's what it was. I was maybe on the nerdy side on it, but I like what I was doing.
Okay, cool. And then once you graduated, what was that transition like from school and then going to work as a dentist in this area?
That's a good question. I mean, are you talking about general dentistry or talking about perio?
I would say perio.
So it's interesting. Your first job is never your only job. Yeah. Just so you guys know. Even when you guys graduate as a dentist, most likely you'll be changing that position within the first 6 months. Very likelihood. The one downside about dental school and residencies is that they did not teach you anything about how to transition and what about businesses. They'll teach you dentistry. They did not teach you the business aspect of dentistry. And that, I would say, is one of the biggest downfalls to all dental schools out there, including residency programs. And if you try to bring someone to teach them, most likely you'll get really rejected very badly. So I think it's all up to the faculty, honestly, who are at the schools themselves, who are really willing to share their clinical experience and their professional knowledge, as far as some of them have been practice owners, and help the students kind of navigate their way, especially at their senior year, helping them with contracts, what to look in a dental contract, what to expect and what to ask for. And I think that's the part where I think most dental students really need the help in, and where they need more guidance. I think by the time you graduate, most of you guys will be, you'll be clinicians. You'll know how to diagnose. You'll know how to treat. That's not an issue, I think. But a lot of students stay stagnant, meaning that when they graduate, they just don't want to improve. on themselves and with continuing education. If you don't do that, you're going to be so far behind. Everyone's going to be 10 to 15 miles ahead of you because dentistry is evolving so quickly. And it's getting more and more aggressive in private practice, I would say. And everyone wants to do everything. Like, referring to specialists, sometimes it's good, sometimes it's declining because dentists want to keep everything we call it in-house. They want to bring the specialist to their office now. They don't want to refer things out because there's more money for them from a business point of view staying in-house. So I guess these are the things that just no one teaches you in dental school. And unless you ask for it specifically, you're going to leave as like, okay, what am I going to do next? What should I be looking for? Who can I talk to? Make sure you guys find yourself a good mentor, colleagues, dentists in the area, someone that you've maybe when you go back to the summer break, someone you can shadow in your hometown, for example, if you're going back, and ask them as many questions as you can, as far as practice transitioning and going from dental school to private practice. If assuming you're not going to any type of residency out there. You're going to graduate most likely with $250 to maybe up to $500,000 of student loans. It's a lot of money what dental students are going through. I mean, I'm 7 years into private practice and I'm still paying my student loans, and I have maybe 3-4 more years to go until I'm fully done with it. Just because it builds up, there's interest upon interest, and it takes time. So, and if you're have a family of your own and all those things, then naturally there's always going to be more priorities, where your money is going. So these are things that, it's good to keep in the back of your head. And as far as you're transitioning, where you're going to, living the lifestyle of the area, living in California versus living in Texas is different. There's more taxes you have to pay in California. State tax versus there's no income tax, no state tax in Texas, for example. So there are pros and cons in the areas you're living at. Your salary might be higher in California compared to Texas, but you're paying way more taxes over there as well as state tax. So these are things that it's good to ask about. Where you're moving and the dentist per capita and how many patients you can see, and so it's always good just to be prepared, ask a lot of questions. Have an opportunity to, again, shadow if possible. Right now, there's a lot of corporations out there which are giving really good startups as far as, incentives and as a bonus salary, bonus startups, and how to transition. Some of them will give you a very good quality of education. Most folks don't stay there. They may stay with the corporation for 6 months to a year just to gain some more clinical experience, and then after that they'll call it quits and find more of a private practice, owned by someone, or they'll either decide to open their own, or just buy someone out over time. So again, it's always the business part that's the hard aspect that unfortunately dental schools are really lacking in, and they don't teach you very well about it.
That makes sense. And I know you mentioned that people often have several dental positions. How many positions related to dentistry have you had, and what kind of experiences have those been?
Say that one more time.
Yeah, so how many dental positions have you had, in other dental offices or anything like that? And what kind have they been? I know you also mentioned teaching and something.
So positions so I'm a periodontist, so I work in between multiple periodontal practices. So I've also been a mobile periodontist, which means I have my surgical equipment with me, I have all my gear, and I go to a general practice office and I do work in there for specific practice. As far as positions, what I do, I'm a clinical I'm a associate clinical professor at VCU in the Department of Periodontology. I've been doing that for 6 years now. I pretty much 1 year after I graduated from my residency, I decided to go back and give at least, continue to get back and teach back to my residents and my co-residents. And in addition to that, again, I do also advanced soft tissue courses. That's to do gum grafting procedures. So that's for doctors, dentists, specialists like myself, prosthodontists, oral surgeons, who want to advance their soft tissue clinical skills, and then they want to apply it to their practice. So those are more advanced courses that we can give after they finish their post-graduation. It's usually for 2 days where we go in and out of every aspect of gum grafting, from a single tooth to a full mouth rehabilitation of soft tissue grafting and around teeth and implants. So that's kind of the positions that we do.
And then is that your position at Periodontist? And so what encouraged you to create that?
That's part where me and my colleague, thanks to COVID, so these are our IG handles for Periodontist. So Periodontist is strictly for gum grafting. Mm-hmm. Mine has a mixture of everything, pretty much. We put a lot of time and effort in those cases, and actually in about 45 minutes we have a live IG. We're going to be me and my colleague Dimitri, who is my partner with the Periodontist, and we're going to be discussing about 6 cases. He's going to show 3, I'm going to show 3, and usually it's open for everyone who wants to watch it, and we'll go in about diagnosis and how we did our treatments and why we did it this way and kind of our thinking process. So, and we'll have people comment and watch us, and it's really fun, cool, and entertaining. We do it usually every few months, and it's amazing. I got a lot of my patients found me through the live IG because they watched it one time. It's like, oh, this is interesting. I want to go to this guy, and they fly. I have patients fly from Ohio that want me to do their surgeries because I was like, I've seen your work and I've seen your Instagram, and they'll fly in the night before. I'll do their surgery in the morning, and I'll fly back out the same day. And I try to convince them to stay, but some people have jobs and works, and they end up going there. So me and my friend Dimitri Ivanov, who's a periodontist in LA, we met through COVID, like in COVID, and through we had our happy hours on Thursdays, and we got people more. Everyone was connecting to everyone, and our happy hours on Thursdays during COVID, where no one was working, we would be drinking, pretty much, and we had a great time. So it was maybe a group of 10 periodontists in that group, and we decided, it's like, I love gum grafting, he likes gum grafting, well, let's do a course designed specifically for gum grafting. So I know we've been doing that for the last year. We've had maybe 4 or 6 courses now. I can't remember, maybe 4 courses. We have 2 more. One is in June, and the other one, one is in July, the other one's in November, actually. So those are the ones that are coming up in the next few months. And it just focuses, again, all about soft tissue grafting. So if you guys are up for it, please follow us on I'm going to be the person starting it, so on my own private one. And you'll be able to see what we discuss and what we talk about in the next 45 minutes, hopefully. So I still have to add one more case, because once I finish this, I have to still add more cases and get it done. And we'll be ready to go live after that. So hopefully you'll be able to join us. But yeah, that's how we end up starting our Periodontist Instagram page.
Okay, yeah, it's very interesting starting something that you saw there was kind of like this niche in.
Honestly, I never met the guy. We've been talking for 2 years, and I met him for the first time in our first course. So I was like, hey, how's it going, man? I know you, but I've never met you.
Yeah. And related to that, what do you think has been your most difficult case? And then do you have contacts that you go to when you have difficult cases, or do you just tend to try to figure it out mainly on your own?
Good question. I think for us, there are cases that are really challenging, like the case I just showed you with that big block graft on the lower jaw. Maybe that was one of the most challenging bone grafting cases that I've ever done in a young guy like this, because you want to make sure that you do your best for those patients. These surgeries are very technique sensitive. The risk of infection can go up high. The risk of exposure of that bone graft can go up. If any of these things happen, then you lose the whole area. And I've had cases where I've had one gentleman who he had also a very weird pathology in his mouth that we were not aware of, and he had a biopsy done in the past, and we never knew what the results of the biopsy were, not until he was referred to me, and I did the surgery, and then I found out later on that he had a very weird pathology developed there, And that pathology affected our entire bone grafting surgery. And we had a major disastrous failure. And pretty much he lost almost 6 teeth in that process, 5 to 6 teeth. So there are surgeries where they can be, if the results are not there, they can be devastating from an outcome point of view. But he understood what was going on. So we're slowly trying to work our way and rehabilitating his case one more time. A lot of those times when we do get to see some of our own failures and we're not seeing good results, I will always reach out to my colleagues. And sometimes before even I start those cases, I'll call a few of my colleagues who are, definitely have had more surgical experience, have been practicing longer than I have. And I was like, hey man, what do we do with this case? I'm stuck and I'd love to pick your brain. So we'll sit down, it'll show CT scans, clinical photography, pictures that we've taken. He's seen the pictures that I've taken. And then I'll come up with a plan. Sometimes we do invite our colleagues to join us in those procedures, if then just kind of have another helping hand. And we do that a lot. Sometimes I'll have my colleagues, I'll fly to Chicago. Sometimes they'll come to me from different parts of the state. So I'll go to them and they'll drive back to me. So just like they're within 150 to 100 miles. We are definitely flying. We're definitely driving towards each other and just helping each other. I mean, it's a small community. It's a small world within our field. Everyone pretty much knows everyone. And so I think the key thing is a good communication and knowing your surgical limitations, what can and cannot be achieved. So, we all have our failures, and that's part of the learning process. I mean, you're never going to have 100% success rate on every surgery that you do. But the ones that fail, they definitely humble you, and it makes you really think twice. And documentation is key. I think if you don't document your surgeries, at least I do very extensive documentation, I will never learn from my mistakes, and I will never see where I did wrong. So it's a good habit, I think, to start doing that, especially if you get to private practice. It doesn't matter if it's a simple filling to a very beautiful full mouth rehabilitation. If you don't document, you don't see the errors in your work, even if they're so small and minute, but it really makes a difference in the long term. So that way you can get much better results that way, and you have the least chance of failures developing, and negative outcomes. So that's what I would always recommend. Have a good, solid group of friends that you can reach out to and talk to, and more experienced than you. If you stay with the same group of the exact same level or less, you're never going to learn anything. So pick people that that they're better at it than you, and you can learn more from them, because that's how you grow.
That makes sense. And then, is there a certain procedure that you do most often?
Yeah, gum grafting.
Gum grafting?
And you know what's the most common age group? Your age, which is that from 20 to 30.
Oh, I love that.
It's very common, and the reason mostly is because they've had a history of orthodontics and braces.
Okay.
It's 90%. 90% is braces, is what I'm seeing, and now in today's day and age. So they're keeping us they're keeping us having good jobs. So I have to thank all my orthodontist friends for the way they're doing their braces today versus 10, 20 years ago. It's much different. Orthodontics has changed significantly. And their people have beautiful teeth, but long-term consequences that we're seeing is more gum recession that those kids are developing when they're 25 years old, they're 26, and they have full mouth of gum recessions. Like, what on earth happened? And just the way orthodontics is being done, it's gone a little bit. I'm not going to ortho, but it's gone more expensile, which means that they're doing more expansion of the jaw, and they're pushing the teeth outside the jawbone. It's causing more gum recessions developing in most of our young patients, which is scaring because they're 25 and almost half of their teeth are outside their jawbone. So you have to talk to the orthodontist, hey man, put things back where they were. Otherwise, those young patients are going to lose their teeth at one point in time. So we're doing a lot more gum grafting on those young patients.
Okay, and are there any procedures that you don't like performing as much?
As a periodontist, I don't do much wisdom teeth anymore, third molars, because I leave that to my oral surgery colleagues. They're just faster and they're better at it than I am. I mean, I do them. I used to do them a lot before, but honestly, it just breaks my back, and it's not worth it. Even from a financial point of view, they are more efficient. They're way faster than I am, and they'll do a much better job than me. And their recovery for the patient is going to be smoother. So, can I do it? Yes. Do I need to do it? No. I don't have to. I can do perfectly fine with that one specific procedure. Another specific periodontal procedure, which we do it so much, but I hate it, but we have to do it. It's called the Osseous Surgery. It's the foundation of our perio work, is that specific surgery where we have to eliminate periodontal disease through surgery. That breaks our back. It pays you the least from a financial point of view. It's the least payment, and it breaks your back the most. And patients always complain about sensitivity. So there's no winning in all 3 points. And that one I do hate the most, but we do it all the time. So unfortunately, yeah, that's one of the things that we have to do.
I see. And then transitioning into more of a personal aspect, how do you tend to manage that work-life balance?
I wake up at 4 a.m. I go to the gym at 4:15. I'm back by 6 a.m. in the morning, and then I have to do all my kids' lunch boxes and breakfast and wake them up, take them to school, head to work. I'm usually in the office either between 8 to 5 or sometimes from 9 to 7, sometimes even 8 o'clock at night. Between work, writing your clinical notes, letters to your dentist, talking to your referrals, study clubs. You do give a lot of, we give a lot of education ourselves, doing courses, and, pretty much that's how you have to balance. You have to really create a very fine balance, because everyone wants a piece of you at one point in time, between family and work and all that stuff. So it's a never ending. It's just, but if you love it, you enjoy what you're doing, you'll eventually find that balance. So, I'm usually in bed by 10:30, and I'm awake by 4 a.m. the next morning. So I've been doing it for the last 10 years of my life. But it keeps me going. That's where my energy comes from, is that early mornings. So that's the balance. Not the perfect balance, I do have to say. But again, the nice thing about dentistry itself is that you get to customize your life however you want. You get to decide how many days you want to work. You want to work 3 days? Work 3 days. You want to work 4 days? Work 4. You want to work 6 days? Work 6 days. I work 5 to 6 days a week. I'm used to it, and I like it. I enjoy it that way. So it's exhausting at one point in time. Sometimes I'll take some time off, like a day or two off extra, just so I can, recharge myself. But I'm a person who doesn't know how to sit down. I'm always on the move, always acting. So there are people who love 3 days a week and they want to take 4 days a week off because that's how their lifestyle is, and they don't want to do anything more. And yeah, I respect that. That's who you are. For me, I can't. If you give me 4 days a week, I don't know what I'm going to do with myself. I would be incredibly bored and agitated, and I think my wife might kick me out of the house. 100%.
All right. Well, that was super. It was super good to know and understand kind of what you do as a periodontist, and to kind of just analyze your journey and have all these questions answered. I think that's all the time. Yeah, I think that's all the time we have for questions today. But we really appreciate you joining us and giving us all this insight.